EDI because I really like their experience in healthcare. The fact that they understand the complexity of a hospital versus other types of buildings. I really like EDI because of the people that they have. They do understand healthcare. They understand all the various systems that you'd find in a hospital, which is basically the low voltage and special systems, up to and including data centers. And the fact that they're focused primarily on healthcare really means a lot. I'm passionate about healthcare and hospitals and how complex they are and how important they are in terms of the infrastructure and understanding how the technologies are all converging. What I really like about EDI is they come from the same place. They believe that all these technologies are coming together. They know how to design for that. Experienced. All of them, well, I shouldn't say all, but most of their design team are registered data specialists. And again, with their focus in healthcare, if you're an owner, that's very important because again, you're walking into an environment where you're dealing with patients, patient care, you're dealing with physicians, clinicians, and their special needs, and EDI understands that environment very, very well.
Really, a very first good impression I had of them was their website. I'd seen all the past work they had done with healthcare, and it sold us.
It was good that they had a very in-depth understanding of healthcare.
It was very refreshing to see a company that's ahead of the curve in healthcare. Convergence over the last 10 years has been a major factor when you bring in clinical engineering into the IT world. It's been, you know, of course, you have the biomed, clinical engineering, they don't know IT. IT doesn't know, you know, an MRI from a, you know, a smart pump and that type of thing. And with the IP convergence, we're just scrambling and scrambling. And EDI is ahead of the curve on that, and they can come in and they can explain that in layman's terms to us and help us build out an infrastructure that'll support both, you know, the clinical engineering side and the IT side.
The knowledge is really deep. I mean, it's amazing how much they know in so many different aspects, and it's deep and it's current. Because, you know, healthcare's changing fast, IT's changing fast, and they know, like, trying to think of an example, like one system, you know, went through a recent upgrade, and now the old technology to make them integrate doesn't work anymore. You got to get to a different level. The nurse, like your nurse call system and your advanced TV system, they both use the same pillow speaker, you know, just as an example. One turns on the TV, and another function you call a nurse, right? But it's the same system. It's 12-pin connection, and it's got to work with both systems, and they pretty much know what works with what.
It was good that they had a very in-depth understanding of healthcare.